they not only reached out to women in need of risk reduction method, but also empowered them to protect themselves in different predicaments.
এটা চলবে অবশ্যই। একটা মেয়ে সে নিজের হাতিয়ার পেয়েছে, চলবে না মানে? সে তো নিজের শক্তি পেয়েছে, নিজের সুরক্ষা পেয়েছে, নিজের বিপদের হাত থেকে বাঁচতে পারছে। তার আর্থিক সহায়তা যতই খারাপ হোক না কেন, তার জন্যই তো তাকে এই জায়গায় আসতে হয়েছে। এই জায়গায় এসে সে নিজের সুরক্ষাটা পেয়ে গেছে। সেই জিনিসটা আমরা তাদেরকে বোঝাতে পেরেছি। তুমি যাই করো, তুমি বাঁচলে তোমার পুরো পরিবারটা বেঁচে যাবে। সেই জায়গাতে আমরা এই এফসিটাই সাকসেস হতে পারছি।
যে ধরুন যারা বউ আছে, তাদের স্বামীদের সাথেও যদি এই এফসিটা ব্যবহার করতে পারে, তাহলে তাদের পক্ষেও খুব সুবিধা হবে। আমরা চাই প্রত্যেক মহিলারই ব্যবহার করাটা উচিত। সেই পেটেও বাচ্চা আসবে না এবং রোগও আটকাবে। দুটো কন্ডোমের মধ্যে একটা যে কোনো মানুষের, ফিমেল করলে ফিমেল, মেল করলে মেল, দুজনের উভয় পক্ষে ব্যবহার করাটা উচিত। তাহলে এইচআইভির হাত থেকে বাঁচতে পারবে।
The users are convinced that the product has benefited them in many ways, from reducing sexually transmitted infections to giving them a personal tool to cope with demanding partners and deal with aggressive and often drunk clients.
ఫిమేల్ కండం అనేది ఒకటి ఇచ్చింది. ఆ కండం తెలియదు నాకు యూజ్ చేయటం కూడా. అది మళ్ళీ తను యూజ్ చేయటం అని డెమో చేసి చూపించింది. ఇట్లా వాడుకుంటే చాలా నీకు ఎస్టీవీ ఏం రావు లక్ష్మి అని చెప్పినప్పుడు సరే అని చెప్పి అది నేను తీసుకెళ్ళి డెమో చేసుకొని వాడుకున్నప్పుడు అది బాగున్నప్పుడు ఎస్టీఐ నాకు ఇక రాలేదు. అప్పటి నుంచి కూడా ఇంతవరకు రాలేదు. ఇప్పుడు మా పిల్లల్ని కానీ నాకు హెచ్ఐవి వచ్చిందనే భయం లేదు నాకు.
ஆண்கள் வந்து குடி போதையில் வர்றவங்க, கஞ்சா அடிச்சுட்டு வர்றவங்க கிட்ட வந்து பெண்ணூர் எப்படின்னா ஆணூர் எப்படின்னா அவங்க உறிஞ்சி வீசிடுவாங்க. ஏன்னா குடி போதையில் நம்ம பெண்ணூரை போட்டுக்கிட்டோம்னா நம்ம தெளிவாக தான் இருப்போம். குடித்தா நம்ம அவங்க குடிக்கிற மாதிரி அடிச்சுக்கிட்டு சும்மா இதாக தான் இருப்போம். அதனால் பெண்ணூரை போட்டுக்கிட்டால் நமக்கு நல்ல பாதுகாப்பாக இருக்கும். ஏன்னா அவங்க வந்து அவுத்து விட்டு நமக்கு இருந்தால் நமக்கு பழகு நம்ம போயிடும் இல்லையா, காண்டை அவங்க கழட்டுறாங்க இல்லையா, நமக்கு நம்மளும் குடிச்சிருப்போம் அப்படியே போயிருப்பாங்க. அதனால் நம்ம போட்டுக்கிறது சேஃப்டியாக இருக்குது.
Different situations, different circumstances. But women across the country have developed their own rationale to use and promote the female condom. Whatever the rationale, there was only one thumb rule. We care for our health.
నా భర్త ఎక్కువగా సెక్స్లో పాల్గొంటూ ఉంటాడు. అలానే సంవత్సరం తిరిగి ఒక బాబు. ఇలా సెక్స్ చేస్తుంటే మళ్ళీ ప్రెగ్నెన్సీ వచ్చిద్ది. నేను చాలా ఫీల్ అవుతూ ఉండేదాన్ని. అలాంటప్పుడు మా హాట్స్పాట్లో మా సీజీ వచ్చి ఈ ఫీమేల్ కండం గురించి చెప్పిందనమాట. చెప్పిన తర్వాత ఇక ఆ ఫీమేల్ కాండం గురించి యూజ్ అన్నీ తెలుసుకున్నాను. తర్వాత ఈ ఎఫ్సీ కాండం మా వారి దగ్గరికి తీసుకెళ్ళి, సరే నువ్వు అది వద్దంటున్నావు కదా, నేను వేసుకుంటాను, అప్పుడు నీకు ఒకసారి వేసుకొని చూడంటే తనకి రిలీఫ్గా బాగుంది. తనకు కూడా సరేలే అని ఇద్దరం আন্ডারস্ট্যান্ড করছি। దాని గురించి ఆ ప్రాబ్లం అలా సాల్వ్ అయిపోయింది।
এতদিন ধরে যে আমরা কাজটা করে এসেছি, মেল কন্ডমটা আমরা যে ব্যবহার করেছি সেটা কাস্টমারের উপরে বা বাবুর উপরে নির্ভর করেছিল। কিন্তু এখন আমরা এই এফসিটা আসার পরে এটা আমাদেরও একটা মেয়েদের হাতিয়ার হয়েছে, যাতে আমরা যদি কোনো বাবু ব্যবহার না করে সেটা আমরা তাকে বুঝিয়ে বা আমাদের কাউন্সিলিং করে যে তোমাদের কোনো অসুবিধা হবে না, এটাতে বেশি মজা হবে বা অনেক রকম আমরা তাকে কাউন্সিলিং করে তবেই কিন্তু এই এফসিটা আমাদের পক্ষে খুবই সুবিধা।
All efforts made by the peer educators to make this program a success was achieved, but by overcoming many hurdles. They had to address a variety of issues. The women had to be taught on a one-to-one basis on how to insert the female condom correctly. Otherwise, there was a possibility that women will experience pain and physical discomfort and get put off by the product.
The message which we kept reinforcing was right usage of female condom. See, suppose in the first usage if it was really discomfortable or no, if there is some pain, no, that those individuals, those sex workers refuse to use it later. So we have to follow them up, no, make them analyze, make them think, and only because of their usage problem they think it is not suitable for them. So those are the efforts which we took, and now after taking that effort, after 3 or 4 usages, they are coming and saying that it's a pressure device.
Involving the community or involving women in all phases of the program or in all segments of the program is very important. Another thing is that we have ensured that every community guide or peer educator must be able to share her experiences wherever she goes. she must be able to speak about FC, she must be able to do demonstration correctly. That was non-negotiable thing.
The success of the program can be gauged from the willingness to buy female condoms and make repeat purchases, indicating an acceptance of the product at its price.
If you keep repeatedly coming back and say, I want more and I'm willing to pay for it, that means the acceptability is truly internalized. So it is that is being seen. It's not a question of having 500,000 condoms being used by 500,000 women. Even if they're just 3,000 women, but how many times have they come back to ask for it? How many times have they used it? Because it's a repeated use that indicates their commitment, their comfort level, their acceptance, and their willingness to buy it. So it becomes a marketable product.
Through a very, very good peer-led approach, we have been able to take the female condom project to the ground. And in the last 6 months or so, we have been able to actually sell about 40,000 pieces of condoms to the sex workers, which I think is it's very significant because of the fact that these condoms are not supplied free of cost. People have to buy them. And when people have to buy them, there is a kind of a responsibility that they have to take, and there is a sense of involvement that they have in the project. And I would like to say that this entire project, we feel, is a kind of a very big empowering tool. It's an empowering message for this entire community because it has been very well accepted.
The female condom was introduced as a program for women's empowerment rather than a mere product. The involvement of the community in all aspects of the program cycle was key in achieving the high levels of acceptance for the female condom in the community.
When we decided to introduce female condom, one of the major learning experiences that we had based on the global experiences is that the product really is not the most important thing. It is basically the program. And for program to really get that kind of an importance, it has to be basically centered on community. And wherever female condom has been successfully introduced, it has been through community-based interventions. So that is why when we were doing the pre-program assessment, the focus was on engaging community as clear promoters of female condom. And even the way forward, we are looking at female condom being an active community-based social marketing initiative.
The National AIDS Control Organization, after a thorough review of the pre-program, has decided to scale up the program nationwide, recognizing the female condom as a product of choice for women at risk.
Well, we are only thinking of only doubling to 1 million cases. That's about 10 lakh, from 5 lakhs to 10 lakhs. We'll only extend the sites. We'll involve more states in this model, and we will have to first talk to our own the NGOs and see how it when we do a campaign for it, what will be the take up. We'll really scale it up and make this available as a product of choice.
There is no better testimony to the effectiveness of the female condom in India than the pragmatic logic of the user.
ఈ ఎఫ్సీ కాండం వల్ల నాకు మెయిన్ బాధలు కూడా ప్రాబ్లం సాల్వ్ అయిపోయింది. అదే మెయిన్ గర్భం రాకుండా ఉండడానికి యూజ్ చేస్తున్నాను. అది కూడా నాకు కూడా కొంచెం ఇంట్రెస్ట్గా అనిపించింది అనమాట. ఇదిగాక నా ఫ్రెండ్స్కి కూడా చెప్పడం జరిగింది. వాళ్ళు ఇంకొందరికి చెప్పడం వల్ల ఈ ఎఫ్సీ కాండం చాలా బాగా అభివృద్ధికి మాకంటూ చాలా ఇంట్రెస్ట్గా ఒక ఆయుధం లాగా సేఫ్టీగా ఉంది.